challenge that a good number of households might not be able to raise these amounts times 12 as per the provisions within the law. So there has been a relaxation so that to enable members to be able to contribute per month. There are also initiatives about having wallets. So wallets is where you can be able to set aside some amount every month so that at the end of the month it actually uploads into your account.
Addressing challenges faced by users during a media roundtable, Health Cabinet Secretary Deborah Baraza has acknowledged the initial teething problems but assured that Kenyans will soon be able to access primary healthcare services up to Level 4 facilities. The Primary Healthcare Act requires all primary healthcare be sought at Level 2 and Level 3 facilities before a referral can be obtained in a Level 4, 5 and 6 hospitals.
We are still in the transition period. What we have said is that up to Level 4, we will open it for a primary healthcare level, so that up to Level 4, Kenyans will be able to have outpatient services as it is in the primary healthcare level. Until our referral systems are robust, until we have ensured that all Kenyans are informed.
The changes, however, come on the backdrop of an audit report for the financial year 2022-2023 from the Office of the Auditor General showing that a majority of Level 4 hospitals in the country lack requisite machine and basic amenities such as water and a drainage system. 20 of the hospitals have expired stock of drugs, with Muranga alone having expired drugs worth 965,000 shillings. Premium paid by those in the informal sector will, however, not be backdated.
For the formal sector, the income is known. Therefore, we don't prioritize the PMT for the formal sector yet. It depends on when you register and start making the contributions. So it's no backdating of premium that ought to have started being contributed, because when they are not registered and they are not contributing, they are not accessing the services. Yeah. So we are not meeting the liability as far as their healthcare expenses go.
The transition to the Social Health Authority, SHA, has now registered over 13 million Kenyans, 4,760 public and government facilities, 2,498 private facilities, 1,442 faith-based centers, 17 community facilities, and 86 other healthcare institutions nationwide. Bentura Komboka for K24 TV, Nairobi.
The Non-Communicable Disease Alliance has called on the Ministry of Health to streamline the new Social Health Authority and the Social Health Insurance Fund to ensure patients with non-communicable diseases access critical health care. The patients say they're experiencing systemic delays in access to critical care, forcing them to wait for long hours to access life-saving services like renal care and cardiac services.
The issue with non-communicable diseases, if they're not properly managed, they'll develop into complications.
Kenyans living with non-communicable diseases say that SHA coverage in private hospitals is restricted to particular civil servants, a move that has denied Kenyans access to services, with NCDs accounting for up to 41% of deaths in Kenya.
If you have diabetes and it is not well managed, if you're not able to access treatment and care, or if your treatment and care is interrupted for some period of time, you're likely to develop life-changing and, in most cases, life-threatening conditions. Major complications of diabetes and hypertension include kidney failure, for diabetes, blindness, amputations because of wounds which will not heal, and many other conditions.
Through their Vice Chair, John Gikonyo, the caucus has called on the government and the Ministry of Health to settle all outstanding NHIF debts to allow service providers to confidently accept SHA patients and reduce financial burdens on patients.
Restricted shift coverage to civil servants in specific job groups, leaving most NCD patients ineligible. Cancer patients, transplant recipients, and other high-risk groups are especially affected by these limitations in coverage, leading to an increased reliance on out-of-pocket payments. Public hospitals such as Mama Lucy Kibaki and Bagathi Hospital are unable to perform advanced procedures like cardiac surgeries for SHA patients, severely limiting life-saving interventions for NCD patients.
They have also urged the government to resume overseas treatment to support patients requiring specialized care
that is unavailable locally in a bid to restore patients' trust in the system and enhance transparency.
We have a pediatric case which is pending to be paid by SHA. The patient left Kenya under very severe condition on 22nd September. The baby was aged 4 years. They had complications with the heart and also they had some issues with their blood physiology. So the baby is detained at a hospital in India called Fortis Memorial Hospital. They are saying that the 500,000 that the NHIF issued as a GOP, guarantee of payment, must be honored before they release the baby back home. The baby has already been treated. The baby is in the hospital, and maybe last week the baby developed some complications. Of course, you see, when you're in the hospital, yet you have already had these surgical procedures, you're prone to infections. So we urge the ministry, we urge SHA leadership to come in and ensure our baby who is stuck at Fortis Memorial Hospital in India comes back.
Robbie Omondi, K24.
Tensions continue to rise between the university's academic staff union UASU and the Inter-Public Universities Council Consultative Forum as the ongoing strike has since paralyzed learning in public universities and showing no signs of ending soon. The dispute centers on the implementation of UASU's 2021-2025 collective bargaining agreement, with UASU demanding a 9.7 billion shilling payout, while IPU CCF insists that the government can only provide 4.3 billion shillings. Harechime has more.
We are back to that.
In a tense exchange before the National Assembly Education Committee, both sides made their submissions, with UASU holding firm on its demands. The key issue remains a lack of funds to implement the union's demands.
By the top minds of this country.
IPU-CCF, representing the government and the university management, argued that the available budget is limited to just 4.3 billion shillings, far below the 9.7 billion shillings that UASU insists is needed to fulfill the terms of the 2021-2025 CBA.
The first scenario, they said, the way they have calculated it, they see that the cost of implementing this CBA is 8.6 billion. They came up with another scenario. We call it scenario 2. Where now they said the cost of the CBA is 5.1 billion. 3, where they came up with 4.3 billion. In this 4.3 billion, they were giving every employee at the university 7.6%. And I want members of the committee to note, there is nowhere in the return to work formula where 7.6% is mentioned. Now they are telling us what the government has offered is 4.3. Let us try to fit it. I want to say whether you fit it like what, it cannot conform to the terms and provisions of the return to work formula.
The Education Committee further raised concerns, questioning why IPU-CCF was unable to provide any documents confirming the availability of the 4.3 billion shillings, despite repeated assurances.
That is the procedure. But now in the context where 4.3 was brought on board, the government was the one chairing, not myself.
We know government works on paper. That this is what we have for you. Where is the document?
Chair, we do not have the document now, but the committee can avail that document at a later time.
As part of their demands, UASU is pushing for a 7 to 10% pay increase for lecturers, with those with higher grades set to receive a higher increment. The increases are to be backdated to cover the 2023-2024 and 2024-2025 financial years. On the issue of increment in the retirement age for university staff to 74 years.
Why should a lecturer actually stick in the university up to 24 years or 74 years when we have people with graduates? I mean, graduates with masters and PhDs who can literally take that.
Professors don't retire. World over, go to Oxford, go to Harvard. Professors who are in their 90s are the ones who come out with cutting-edge researches. And our members are now being forced to clear from universities. While we have an agreement, they know it is 74.
As of now, OASU remains resolute, declining to call off the strike until the government meets their demands, which include harmonization of allowances, comprehensive medical covers, and a budget for promotions and housing loans. Harriet Chimea, K24.
Back to the future. The future is simulate. Bet smarter. Win faster now. Be a winner. More at Bet.
Have you watched K24? We would love to hear from you. Send us your feedback on what you like and what you don't like and why. You can use any platform to reach us. We can be reached on